I also want to ask you about, because you mentioned at the beginning when we started, and I made a note about it, is that you get referrals from pediatric practices, pediatricians in your area. I found that this is an extremely difficult thing for a lot of optometry practices to set up, like a referral system. And it
Yeah.
often just entails going and talking to the pediatricians. Can you go more into y'all, like how y'all developed that
Yeah.
program?
So after I moved up here, now I do have my background. I think that helps to show that I was working with pediatric ophthalmology and I had background with pediatrics. But I honestly, I think it was me going in the offices with confidence saying, yes, I feel comfortable seeing the 6 month old or this 3 year old or a patient with strabismus or amblyopia. It was really just going in with confidence because I think we all have our comfort zone and they need they need direction on where to refer and feel comfortable with that. So when I first moved, we set up lunches and kind of like a rep came in and just I hung out during lunch with our office manager and just met everyone and kind of talked about different referrals that they might have or questions over referrals and just offered my services. Um, but I just kind of, as I said, just go in with confidence and show that you are competent in working with pediatrics because there's not enough of us, and there needs to be more of us that are able to help with that. And I think our children's hospital is kind of hard to get into at times, so I'm trying to help out with that, especially in the suburbs.
Yeah. So like what is like can you go more into like what your messaging was for your like that initial approach? Because I think that's probably the hardest part is like, because you mentioned setting up lunches. Like, I think like what a lot of ODs forget, who aren't like as open to just approaching anybody for referrals, is that like generally speaking, pediatricians want to know this information. Like
Yeah.
I've seen data that says that like a pediatrician, their at least years ago, their referral system, if they see that there's a problem, don't even know to go necessarily to an optometrist. It's usually like an ophthalmologist is their first, first person to go to. So, like, how did your office and you called it like what kind of messaging do you come in with? Like, and if you can go more into that, I guess.
Yeah. So of course, we came in with business cards and all the information. I brought even some information about myopia management, but they wanted to know that I I saw amblyopes and I did patching and I um, could assess strabismus patients. And if there was a strabismus patient that needed surgery, I'll refer them to pediatric ophthalmology. They wanted to know that I could see an eye infection or give them initial evaluation on a nasolacrimal duct. That I just brought up diseases that we typically see with pediatrics to show that I do feel comfortable in this and I can be a
Hmm.
resource for you. And we do see urgent care patients. So if you have something you're seeing in your urgent care pediatric practice and we're in clinic, please call us because we'll help you with an abrasion. We'll help you with all of these things because they're in their zone. They need help, and trying to get a kid in quickly to be seen sometimes hard. So I just I laid everything out on the table with all those discussions. But those were the biggest questions they would ask me. Do you feel comfortable with patching? Do you feel comfortable
Hmm.
with doing some of these treatments that we typically see with the amblyopia? And now that we've crossed that bridge, it's okay. You might see some of our kids wear these types of contact lenses or
Mm.
atropine. So last time I was in a pediatric practice during one of those luncheons, they asked me, "Oh, we had a kid in here that does atropine at night. I think someone that you work with, they had an eye infection. We were worried about the antibiotic we were using with them using the atropine at night." So it was nice to have questions even regarding that. The nurse practitioners and the nurses there also are part of that conversation. So everyone as a whole is good to be able to discuss within those practices.
Right. I love it. So you started with the natural, like I can be a source for you if your patients run into these issues, and here's what we can do at the practice. And then just kind of, it sounds like gradually brought in that myopia
Yes.
conversation, where I think like, you know, maybe where some ODs are going kind of wrong then with this is they're starting with the myopia conversation because I mean, I have communicated with pediatricians in the past and they don't necessarily even know much about myopia management to begin with, and that is often a process of education. Although they're very quick on the uptake, the pediatricians that I talked with. So I think that's interesting. Like making sure that they understand like what your value is and what you offer at the practice and what that relationship looks like, and then gradually bringing in myopia management.
Yeah. I think that's important. They need to know that you're comfortable with the disease, you're comfortable with the vision screenings, and then that's the second layer, and you're staying on top of studies, and you're saying, "This is what's come out now. We have Stellest available, we have my site," just showing that you're competent and staying on top of that.
Mhm.
We actually have a couple of our local pediatricians, their kids are in our myopia program. So it's great. It's good to see, and I know they're starting to get more and more education about it too.